What we have here is a Newtom VGI cone beam CT scanner. This is essentially a high-tech X-ray machine that gives us a 3D image of the important structures of the teeth, bone, jaws, even the nose and sinus and spine can be visualized. The Newtom is a representation of the highest technology that we have, the best definition that we can get, highest resolution in digital imaging and 3D imaging today. I'd like to show you a little bit about why we use a 3D scan or a cone beam CT scan in preparation for dental implants. The image that the CT scan gives us shows us all of the patient's teeth, bone, and jaw structures. It also shows us other vital structures such as nerves, sinuses, and the soft tissue features of the jaws. When we look at this rendering, I can look down from the top of the patient's skull, and I can see that here, above the space where we used to have upper teeth, there's a sinus, and this black area shows me that the bone is very thin there. When I am preparing to place an implant in this area, it's critical for me to know how much bone is available, how much space is between the outer surface of the bone and this sinus as we can see it here. An implant that penetrates into the sinus is more prone to complications such as infection, inflammation, and ultimately failure. Similar considerations have to be taken when a bottom implant is placed because of the important nerves that run through the lower jaw that can be damaged if the clinician is not aware of their position and their depth within the bone. This opening that we see in the lower jaw is an important opening for the nerve of the face that gives sensation to the lip and chin, and if, for example, a clinician was to damage that nerve, it may lead to permanent numbness of the lower lip and chin, which is an unwanted complication that can be avoided by proper three-dimensional imaging. I wouldn't dream of placing an implant without first being able to precisely image and visualize and measure the important structures in a patient's jaws prior to placing an implant. This is the latest, highest technology imaging system that is available on the market today, and to my knowledge we are the only office in northern Colorado that offers this imaging quality.